Good afternoon, and I'd like to welcome you to the 7th edition of Black and Red, where we reach out to some of the most influential influencers, haha, I just used the same word twice, around the country who are Black or African American or doing work in African American spaces to address COVID, politics, HIV, viral hepatitis, substance use disorder, and a myriad of other things. Today, I'm super excited to have time with, actually, because she's so busy, with my friend, colleague, and the representative from Alabama. I'm going to let her introduce herself. Representative Laura Hall, do you want to tell us a bit about you, where you're from, the district you represent? Representative Hall.
Thank you, Tony. It's a pleasure to be with you today. I am Laura Hall, State Representative for House District 19, which is in Madison County, in the city of Huntsville, but I do have some of the county area within my district. I represent about 45,000 individuals.
Well, thank you so much. So, one of the reasons that we started Black and Red, or wanted to think about Black and Red, was we started looking at the COVID pandemic, and we looked at how it was impacting African American communities, particularly those in red states and red jurisdictions, slightly differently. That there needed to be a heavier lift, there needed to be more work, there were more politics involved, but there were Black folks that were really instrumental in getting resources, changing those policies or addressing those policies in those jurisdictions. Can you tell us a bit about COVID and how COVID impacted your district?
Well, I think so. COVID is the disease that really helped us to really see many of the challenges that those of us that are represented, African American representatives, already knew that we are impacted in such a greater level, a greater number than other individuals. The main thing, or one of the first focus, was really having our people to understand how important it was to even get the vaccination. But beyond that, also, and the number of individuals I knew personally that died because of the disease. So this challenge that we faced and are still facing, because according to the information that I read on Friday, that our numbers are going back up. So which means that we are still having those disparities that we know that exist, that in terms of adequate child care, adequate health care, all of those are adequate housing, all of those challenges still exist, but it's even at a greater level because Huntsville is a place that is growing, and in its growth, many of, let's say, low-income individuals, the areas where they live, those buildings are being torn down and they're redeveloping that area. Well, the redevelopment for that area does not allow them many times to use the vouchers that they've received to even live in that space. So we have many of the challenges that you will hear about across the country, but we are certainly impacted in a great way here in Alabama.
Well, thank you. Thank you for that answer. One of the things that we, were looking at and are continuing to look at are immunizations overall. And I'm hitting you with this question out of left field. So you might say, I don't know the answer to that. But one of the things we're also looking at are childhood and adult immunizations, and everything from the flu to meningitis to shingles to pneumococcal pneumonia for seniors. Are you seeing an increase, decrease, or any sort of shifts or any sort of acknowledgement that we need to do more around immunization, particularly in young people, people of color, and seniors in your district?
So for children, the immunization, pretty much I found that many of the individuals in my district will follow the rule, which says that your child must have all of these shots and you must have the blue card for them to attend public school. Now, if in the African American community, that has not been a big challenge. We tend to do that quite well. In the white community, there have been pushback in terms of their rationale or reason may be based on some history that they've had with their children getting shot. But in the African American community, for children, that has not been a major issue. The issue for us was when it was time for the immunization for COVID. There had been so much information that had been provided, much of it was not accurate, and they weren't sure. So we spent, Representative Daniels and I spent a lot of our time during that time having informative individuals who had the knowledge presenting the impact of COVID and why it was important for immunization. So we still have individuals that are still kind of hesitant. But I do see and feel that we are moving in the right direction. We do have individuals that are willing to take the shots. But remember now, I live in Huntsville, which is the Space and Rocket Center. It is, there's a large educated base here. And so they're not prone to listen to the stories or the untruths. They're more prone to look for the correct information and take action.
And so Huntsville, thank you for that. Huntsville, tell me a bit about the demographics of your district, not just Huntsville, but your district overall, because I would imagine, given what you just said, even that is Huntsville more white or and more middle to upper middle class? What's the mean income in Huntsville?
Good question, and that'd be, I should be able to tell you that. So within the area where I am, or within my district, it could run anywhere from $40,000 to $60,000 a year.
For $40,000 to $60,000. Now, is that when we think about that? A lot of people that are going to hear this may be in DC, LA, New York, San Francisco, and they're going to say $40,000 to $60,000. Who could live on that? And and the reality is that a lot of people in what I call middle America live on that. Sure. And I think that that's one of the things that I've really been hit with, particularly since I've been doing more and more work in rural and southern communities, is what I call the lack of understanding that folks in big cities have about what really goes on in small towns and in the South. Sure. That folks are, and you think, well, maybe that's two incomes at $40,000, $60,000, but usually it's not two incomes coming into that house. That's one income coming in that house. And it's usually not a single individual. It's usually either a single head of household and a kid or two that Sure. are trying to make it on that. And I think that becomes relevant when you talk about things that you just talked about, housing and the housing shortage and how housing impacts our health, how housing impacts our ability to work, where we work, how distant the work is from where our house is. When you talk about things like public housing, a lot of people don't understand, and this is for the folks that will hear this, is that, frequently when, you see what folks will consider dilapidated or outdated low income housing or subsidized housing that's been subsidized by either the state or federal government, and that housing is going under quote unquote renovation. Usually it's not the same number of units that come back, first of all.
Exactly.
Right. So it usually is a lesser number of units that come back. And then, as you articulated, often it's that the individual who was in that unit before may not qualify for that unit when it comes back. Because it's fewer units, it's more competitive. And now that unit has been renovated, it has a higher market value, even though it's still subsidized housing. So that Sure. means that the individual has to qualify for something higher than he or she left before. So the question I have for you is, what do we do? Because the truth is that even with COVID, we saw the rental market go bananas because people couldn't afford to pay. And even in our supplemental to that, it's that we're paying for the landlord. We're not helping really the
Exactly.
individual renter. Are you
Correct.
seeing any of that stuff in COVID in
Oh,
your
most
district?
definitely. Well, COVID certainly had a major impact on as it relates to housing. And I worked very closely with the individuals who were providing rent assistance. And as you said, that individual that had some other challenges in addition to the rent problem, that individual did not benefit from that. Their landlords did. Um, the other thing that we're seeing more of is more homeless people. Now, I had not seen the number of homeless individuals that would be in the area or in my district. Many of them had been centered mainly downtown under the underpass, but not anymore. They are in the north end of town, which is where I am, and they are there. So what are we doing? We have not had real conversations relative citywide as it relates to that. There are groups and organizations that are working to address the issue, but on a citywide level, no, we've not had that conversation, which is something that I'm sure we will before the summer is over. But it is real, and that is major. And these are individuals who have families, they have children,
Well,
and
and I think a lot of people don't know, and a lot of these folks are veterans, a lot of these,
yes,
and
yes.
that's the other population
Yes,
that's out
yes,
there that
yes.
we've got to really figure out what we're going to do, because I mean, there's some VA housing, but not a lot,
Not a lot.
not a lot. So let me ask you, so when you think about, I hear you say that, maybe you'll have a meeting or there'll be something that'll happen before summer's out. And that's the kind of the good news, right? The good news is that it's the summer months, so it's not as much inclement weather. But you guys are in Hurricane Alley, aren't you?
Yes,
And so,
tornado.
right, tornado and Hurricane Alley. So what do you think? And I know I'm jumping all over the place. You're like, why is Tony jumping all over the place? Because I mean, that's one of the things is that I think COVID taught us, or COVID taught me, that so many of the things, so many of the issues that many people think are in a silo. I can work on climate change over here, and it doesn't have anything to do with COVID. I can work on climate change over here, and it doesn't have anything to do with homelessness. I can work on climate change over here, and it doesn't have anything to do with substance use disorder. But the reality is that if you've got a person who has mental health challenges or behavioral health challenges, and they can't access the services they need, and he or she is marginally or homeless or marginally housed, the reality is that inclement weather is therefore going to impact that individual. And is that inclement weather driven by climate change or by something else? We don't know. So I'm wondering, what are the new programs that you're seeing, or new groups that you're seeing coming down the pike that have been doing good work, that you want to say, what, this is the way that we should go, this is what we have to do to address it? Because it sounds like you've got some of the most vulnerable people in the nation in your district.
We do it. I wanted to mention one other challenge that is caused by COVID, or that has been most obvious by COVID, is access to the internet, broadband. That I saw students. I have a rec center in my area that I go to every day, and there were children sitting out under the covering at the rec center to get access to internet. And they lived right up the street from it. So that in itself, and there were individuals. So if you even take that farther in terms of the healthcare of that individual, that person needed to have access to the internet to have a doctor's visit, telehealth.
Mhm.
That was limited, and those individuals were not going out. So I just wanted to indicate that that's another area that is a challenge. Now, what are the programs? I have been appointed to two committees that I think are major. One is a health task force, and the other is a broadband task force.
Mhm.
And the idea from that, and also the mental health. So the ideas from that is that we must look for ways and provide opportunities and funding to adequately address these issues or concerns that I've raised, such as a lack of broadband, such as a lack of mental health services, etc. So that is from our leadership, from our speaker. He has been very open and receptive to that. And so what I find locally, that the individuals that are working in those fields of mental health are very open, very much want to have those resources and must need those resources. And the other part of that is this, for within the next 2 years, hopefully we will have services that will be geared towards young people. We don't have a hospital that in this area, in the Rocket City, that admit or keep young people who have mental health issues. We have to send them to other areas. So those are the programs of things that I see that are on the horizon, and that I believe that all of the citizens of Madison County can benefit from.
Thank you. People who hang out with me a bit, I think I'm trying to get a cultural heritage designation or a heritage designation for the Appalachia region. One of the reasons is a lot of what we're talking about today. People ask me, why would you try to get that now? Why is that relevant now?
Mm-hmm.
And I think it's relevant now because it's all of these things in a box. It's economic development, workforce development, and public health. And we've had successes in economic development, public health, and workforce development, and in public health, but we usually don't see them intermingled. And what I think COVID taught us is that we got to intermingle these things. And the analogy I like to use is that, there's been a significant reduction in the number of rural hospitals in the United States. More than 100 have closed over the last 10 years, and people don't know that. It's a huge number of rural hospitals and clinics that have closed. But I say, even if we put a rural hospital at the end of the road, and that could be in Madison, that could be here in Hardy County in West Virginia, where I am, if we don't have a road to get to that hospital, that person still can never, ever make it there. If we don't have some form of transportation for he or she to get to that hospital, they still can't make it. If we can't put broadband into that hospital, we can't access electronic health records, they can't do telehealth visits, it's still of no true use. If we don't put in place some sort of plan which says to us, we're going to train workers to go work inside that clinic, and that we're going to offer some incentives for doctors and other medical professionals to come to that clinic, again, you've got a building sitting at the end of a dirt road that nobody can access, and that nobody can work in, and that no one can service. So I think that that's one of the reasons that I want to do this heritage site, is that I think it gives a frame for us to be able to say, we need to put all of these things in one frame. We've been really pushing the CDC, and maybe this is something you and your committees can work on too, is to say to the Centers for Disease Control, you need an office on rural health, just like HRSA has.
That's HRSA, yes.
And so, because HRSA has an amazing office on rural health, but you need one at CDC. There's a point person for rural issues at CDC, and she's great and it's wonderful. But I think if it had department level infrastructure, and if it had department level resources, and if it had department level staffing, then they could address many of these issues that we're talking about here today. What's the relationship with the federal government and the federal partners coming down to support you, to support the people in your county, in Huntsville? What's the relationships been like?
Well, the relationship has been, let's say, limited, I would say at best. But I do, when you mention the idea of a rural department under CDC, immediately I am going to be the incoming chair for the National Black Caucus of State Legislators. One of the things that we do is resolutions that goes to the federal government and to other agencies and we've been very effective in working with those. So I'd like to have for us to have to continue that conversation and see if that's something that we could do in December. The relationship I find with our legislators on the federal level, they are pretty much in their mindset. We have one that serves on appropriations and get millions of dollars, but they generally have been, from my perspective, I have to speak from my perspective, have been for buildings and buildings that are in their names. But the other side of that, one of the buildings that's located here in Huntsville does a lot of work on climate. So that's a big advantage. So the relationship is good, but has that translated into the type of program or uh, programs or events or activities that are going to focus just on my district or focus on people that look like me? No, that's still a work in progress. I think we're making progress. I take the HBCUs in terms of they're being much more open in terms of looking at ways in which they can increase the funding for our HBCUs, and that conversation has basically started within this year.
Mhm.
So those challenges that we faced before COVID as it relates to their relationship still exist, but I do think the possibilities are a lot greater than they have been.
Right. And so do you think that did your members support or not support the COVID supplemental bill?
Which one is that? The last bill that?
Yeah, the last one that didn't get passed. It stalled, right? And so it
No,
stalled in Congress.
so out of the delegation for the state of Alabama, there's only one Democrat.
So that answers the question.
Okay. Yeah.
and so then I guess then that becomes the question, right? So given, one of the other things that, COVID did for organizations like Community Education Group and others around the country is that, we did a great deal of COVID work in the 2 years that those resources were truly available for us to do the work. But, we've been, kind of fighting tooth and nail to say, hey, look, we think that even though this bill didn't pass, and we understand that you don't have that the federal government didn't pass this bill right now. I think, and I honestly, my gut is that we will see some form of this bill come back probably post the midterm elections. Sure. But I think that the question is whether or not we continue to support the organizations that are on the ground doing the work, because do we have another wave? Was the flu, in the gym getting stronger? Do we have another flu outbreak and we're not prepared for it? One of the things I've asked the CDC to do is to consider where they were using COVID resources in the past, particularly for groups like ours that were doing both COVID and influenza work, but is to look at either an expansion of the immunization budget or utilization of immunization dollars, which we don't think are completely expended. What can you tell us about the statewide immunization program in Alabama? Is it well funded? Does it need more money? What's going on with it?
I think at this point, at the point of what they're using, that it has been funded well. I serve on our general fund committee, which is the funding for all of the state agencies. And we've not had that as a negative or as a place of emphasis as we've looked at the budget over the years. And we have one of the best funded budgets this year. And of course, that came because of many of the COVID dollars that we had received. So I think the state's budget on immunization has been funded at the request that has been made by the director of the department. Mm-hmm. Now, does that mean that all of the areas are covered? We've not had a report indicating otherwise. Okay. As I stated earlier, when children go to school, generally the tradition in the state of Alabama is that most of our children will have that blue card that admits them to pre-K or kindergarten. So in that respect, yes, I'd say yes. It's been funded. It's been funded adequately.
Adequately. Okay. I'm going to switch gears a little bit, so it'll be abrupt, but I don't want it to feel abrupt. But it's going to be abrupt. So, how'd you end up running for office? What was the first office that you ran for?
Well, the first state office, well, I've always been active in my community. I was a classroom teacher. So my background is education.
Okay.
In high school. So I've always been involved in my community. If there was an issue or a problem or something that was going on that was being addressed, you would generally find me a part of that organization and trying to address it. And it was because of that involvement and that engagement. And I had also been involved in other campaigns, not mine personally, but my candidates generally lost. But I saw the benefits of their work. I saw the benefits of being involved in their campaigns, to seeing members of those campaigns being appointed by a governor to different commissions like the Mental Health Commission, et cetera. So, but that's how I would start. And so when the position came open, I was asked to run.
So wait a minute, your first position that you ran for was at the state level? Not, get out of here.
The other positions I held that were elected was my sorority, being president of my sorority, and being president of the Education Association. But beyond that, never.
You were, and so you ran the first time statewide.
No, it's by district.
Well, maybe by district, but that's still, I mean,
but the state,
yeah,
the state level, right?
Right. And so, how many challengers did you have, if any?
There were 6. There were 5 other people in the race.
Okay, so 6 of y'all in the race. How many vote? I know, so for those of you who have never run a campaign or been an elected, gotten that ticket that says you're an elected official, what you know is people say, well, what's the size of the district? That's not what the campaign staff tells the candidate. What the campaign staff generally tells the candidate is, hey, here's how many votes you need to win. They don't tell you how big the district is. They don't tell you how many Democrats there are. They don't tell you how many chipmunks. They don't tell you any of that. They say you need 6,514 votes to win. Exactly. And then they tell you where those 6,514 votes are, they think. Right. So how many votes did they tell you they thought you needed to win in that first campaign?
In the first campaign, knowing that the number of people that were running, in order for me to have a possible chance of being in the runoff, I needed to have almost 3,000 votes. It was 2,900 something. I can't remember exactly, but yeah, I mean, and you're right. I mean, there were individuals that knew that. And so, yes, that's what I was told. Now, the rest of the individuals that were running didn't take me serious.
Because you'd never run before.
Right. They did not. They thought I was testing the water. And I tell people all the time, I ran because I had a group of individuals who, one, believed in me and had enough confidence in me to tell me when they thought I was doing something right or wrong. They weren't shy about that. And so it was because of that. And I said, I may not have been the most qualified individual, but I had the hardest working team of individuals supporting me.
And that's what it usually takes. Right. I hate to always admit to people that I've run for office twice. I've never, ever, ever won. And the only reason I ran the first time was because there was a guy I didn't like, and I was like, if he can run, I can run. And I got off of the bus and filled out my papers. And that is how my campaign began. But
just let me stop you there. But your running also causes or help other individuals to be candidates.
Well, right, because and this guy who I won't name because he still works in San Francisco politics, but I really don't think that he probably will ever know that he was the motivation for me to actually do that but I think that that's exactly it, right? I think sometimes it's be the change you want to see. Exactly. And then sometimes it's like that guy really sucks. So I need to try to get him out of office.
Exactly.
And so how many times have you run now?
So I am going into next year will be my 30th year serving in the legislature.
Wow.
Yes, I
Wow.
will. So that means that I have had at least 7 regular campaigns and then a special campaign that's 8
Right. Now,
campaigns.
so is your session a full session?
No, we're not
Okay.
full time. We're
Okay.
part time.
All right. So
So
how many days or weeks or hours is your session open?
we have a total of 105 days.
Right.
So generally, we say about 3.5 months we are in session. And each year we start at a different time depending on, like this year is an election year. So we will begin our next session in April, which gives the new administration or whoever's coming into office an opportunity to get organized and budgets, et cetera, et cetera. And then the following year, it will be March, back February the next year, and then January, the year leading up to the election.
Uh, Now you mentioned earlier that you are either the chair or chair-elect for the National Association of, I think you said Black elected officials. Is that right?
Black elected legislators,
Black
NB,
elected.
National Black Caucus of State Legislators.
Well, that, so how many Black legislators are there in the country now?
Out 700. About
700. That's a lot of folks.
it is.
And so do you guys have an agenda now, or do you set that agenda?
We do under each administration. There's an agenda that is set, and but generally the agenda comes from it's concerned about making sure that every child has an adequate and effective education. Every family has adequate health care.
Mhm.
A child that goes to school has a teacher and someone who is in the classroom that believes that he or she can learn. So those goals and objectives that you hear from legislators come together and agree on how we approach those goals. But generally, you will find that is the gist of the organization's plans and objectives for the citizens that we represent.
Okay. And that's Black legislators all over the United States, not just the
Yes.
southern states, not just,
No.
okay. And so how do you position that organization in lieu of COVID, making sure that there are COVID resources that get passed in this next, because those are state legislatures. How do they, I guess punch up, right? How do they impact their federal counterparts? I guess is how I say that.
One good thing about during these last 2 years, the legislative leader or the leader of the legislature had a great relationship with the administration, the incoming administration. And so and because of that, the organization has been challenged and reached out to many times to say, we need to know, what is your position on this? Or do you have individuals that have a special area, such as it might be broadband or telecommunications, any of those areas that the request for that information. And I think that has been good because it allows individuals who think that they're working in a silo within their particular state feel like, okay, this is an opportunity for me to at least have an opportunity to share with federal government some of the ideas and thoughts that we have. And not that didn't happen before, but it seems to be, it's more open. Let's put it that way.
Yeah.
Yes.
So, one of the, again, you can see I'm changing, and you're like, Tony, like switching it, just spinning her head around so quick it might break. But
I hope I'm answering your question.
you
That's
are.
the
No,
key.
you
Okay.
really are. And I do. I really want to thank you, for all, first of all, for all that you do, but also for taking time to talk about this stuff, because the folks that are going to listen to this, they don't know that, what's the difference in a legislator and and all that. So, and what's
You
the
are
role? And
right.
they don't, and one of the things I keep trying to really get across to folks more and more is that, and we see it more now, right? But that, Community Education Group is a nonprofit organization. We are a bipartisan organization. We have to be by charter and by statute, the federal government, and that's what it is. But the reality also that I try to explain to people is that where we are is that you've got to run for local and state office. That the reality of, and I always use Ferguson as the example. The riots that happened in Ferguson were a response to a mayor, a city council, and a chief of police. And those are all elected local offices.
That's right.
And so why it becomes important that to me is that because of things like that, right? In outside of DC, PG County is one of the first places in the country where you couldn't have a pit bull, where pit bulls got outlawed. And, it did a couple of things. It said, pit bulls were this dangerous dog. But the reality is that people had framed that dog as a black drug dealer's dog. And so they said, okay, well, you can't have it anymore. Well, who are the people that made the decision about this dog? They weren't the people that actually have a pit bull. And I don't know, Ralph the pit bull is fine by me, so I think it could be everything from that. I think we see it now in Florida with the the don't say gay in schools. Those those school board seats are really, really, really important, because they then say, well, how do you teach history? Well, if the history is not one that includes people of color, or the history is not one that we want to talk about LGBT people, or whatever the history, if that history says we don't do that, then, but who says what the history is that gets taught? Is the school board. Can you talk to, if you were talking to some young kid, 5 years old, why is running for office important?
I say I would start with the food that they ate for breakfast. That, did you know that the milk that you drank, that even though it came from a cow, before it came to your bowl of cereal, there were regulations that were necessary in order for it to travel from that cow to your table. And those regulations are decided by elected officials. In many cases, it might have been the Department of Agriculture on your state level. And then it goes from your state level to the federal level in terms of meeting the demands of it. So you can start with things such as eating. Or did you notice when you traveled in the car with your mom to school that you had to stop at a traffic light? And that traffic light was there because the city council or the county commissioners decided that it was important and necessary to have that traffic light there. And so you could take everything that has happened to an individual from the time that the clock went off in terms of the electricity, to the food that you eat, to your travel to school, the books that you received, that you studied, the building that you entered. There were individuals, local individuals, your school board members decided to build that building. Now, to build that building, there were some guidelines and rules that was provided by maybe the state level that says that rooms should be a certain size. And from the state level, the state had to accept or decide whether or not they're going to accept the federal funds that are necessary to build the school. So you could tie all of those levels of government in with just a child's visit or going to school. And a 5-year-old would ask you 1,000 different questions based on that. So that would be a fun conversation. Are you serious? So what happened to the cow? So what happened to the milk if the milk didn't come from the cow? You can just imagine. Of course, you can tell I taught, right? But you can just imagine that conversation with a 5-year-old, and then also instilling that 5-year-old, listen, you are so smart and intelligent. You can be that person that serves on the school board or serve on the city council, serve on the county commission, or serve in the state legislature, or be governor, or the
Right.
president, or the senator, so
Yeah.
yeah.
I mean, I think that's to me, that's exactly it, right? Is that we've got to get kids to believe that public service is still a good thing. I mean, because so many kids think that public service is like, or it's a corrupt process, or it's a process that doesn't reflect them or represent them. So I think that one of the things that we have to do more of is that this is why public service is important. And and again, I think that it takes a unique individual at this point in American politics, whether that's the dog catcher that I was talking about, the school board member, the city council member, the supervisor, depending on what your structure is, the state legislator, the governor, the senator. Because the question I'm going to ask you is, how do you have dialogue? What's the thing that you've learned about the effective way to have dialogue with people or individuals who have diametrically opposed views to yours?
And I've learned that everyone that comes with an opinion is generally based on their personal experience and what they think the people that they represent want them to do. And it is a challenge many times because you hear something that is totally opposite of what you think or believe in. My seatmate and I are different parties, and each one of my seatmates have been that way. But I feel very confident in that individual that is my seatmate. That if I have to walk to the ladies' room or something, I said, if the vote is coming, you know where I am on this issue, right? And that he would not do it otherwise. Those conversations are so important. They are important for individuals that you get to know sometimes individuals. And sometimes I've had conversation with individuals where I totally disagreed with. And they've come to me to say, I heard what you said. And I really would like to work with you on this issue, what you brought up. And that happened during the last session within the last day, because I reminded my colleague they were talking about, I think it was Don't Say Gay, one of those bills that we had. And I said, and so if a child came to my classroom the morning and the weekend after and talked about an incident or something that happened at home, what am I supposed? How do you explain to that child who needs to talk to his or her teacher that they have confidence in? So I
Right.
said, but being respectful of the other person that has a different opinion, yet agree without being disagreeable, which
Right.
is a challenge. That has probably been, and then being honest. I will say that I don't care if you don't like me, but the one thing that I hope that I carry myself in such a way that you're going to respect me, and that I'm always going to be honest when I tell you something.
Well, I'm going to tell you something. I think we're out of time. But I think that that's exactly it, right? Is that we are in a space and a place where I think we often find ourselves having to have conversations with people that may not have similar politics to us. But I don't know that it's a thing of to stop the conversation, to end the conversation. I think is that, to me, that's more of the reason to have the conversation. We don't have to agree, but you from your seat as a legislator, me from my seat as trying to help people in community, I don't get to say who those people are that show up. I don't get to say what their politics are when they show up, but I've got to be prepared to help them when they show up. And I think that your job often is the same. You don't get to, people voted for you, but once you're in that seat, you have to represent the people that didn't vote for you.
Right.
Yeah.
Exactly.
Um,
Exactly.
So, and again, I think that I want to thank you. I want to thank you. It's been so long since I've seen you.
I know.
I haven't seen you. I don't think I've seen you face to face. Oh my God, in more than 5-6 years.
Yeah.
But hopefully we will remedy that soon. I would definitely like to, when you take the full mantle, let's talk about how we can get the CDC to get this Office on Rural Health going. We've been pushing them, and we were going to keep on pushing them because I think it's a very important thing. But most importantly, thank you.
Oh, thank you. It's so good to see you. And I'd say let's not wait until December to start that conversation that you want to have. We can talk to the executive director and see where we can make some start opening those doors.
That would be great, because I'd love to talk to you about, because I didn't even get to the syndemic of HIV, viral hepatitis, substance use disorder, something else I know that's a very much an issue for you and close
Right.
to your heart and your work.
Right.
But that's, a bit of, again, why we want to do what we're trying to do throughout, particularly the Appalachia region, is the, substance use disorder is not gone anywhere. And yes, it's seen differently in different communities. But we've got to figure out what we're going to do and how we're going to pay for it and how we're going to plan for it. And I think that the state legislators, particularly with these resources that are going to come in from a lot of these settlements, what are we going to do? So maybe we should have a different conversation at another date about settlement dollars and about CDC and so forth. So I want to say,
I would look forward to that. I'd say let's talk soon, just offline, just about some other conversations we need to have.
yes, ma'am. I look forward to it. And again, I would like to thank you for taking time out to support us with Black and Red, and Caroline Chukwu and Brandon Morales, who are the producers and media folks that put this together. Without them, I am nothing. And without you, I think that the people of Alabama would not be served as well. So thank you again for taking time out to meet with us, and have a great day. And I'll reach out to you very soon. I'll get some time on the book.
I look forward to that.
All right. Maybe I'll have to come to
Caroline
Alabama.
Yeah, that would be great. Thank you, Caroline and Brandon. I appreciate you all as well. Thank you.